Welcome to the 2026 Medicare Crisis Series. I'm Matt Ferret, and for decades I've been inside the Medicare industry, so you don't have to. In this series, I'm exposing the biggest shakeups hitting Medicare Advantage, Part D, and supplements in 2026, and more importantly, what you can do about them. Back in August 2025, I predicted that more than 2 million people would be forced off their Medicare Advantage plan in 2026. 2 million people will be forced off their Medicare Advantage plan in 2026. Now, we don't have the final number for this yet, but last year's data gives us a strong preview of what's to come. In 2025, service area reductions, or SARs, impacted 1.8 million people. And here's the kicker. Some smaller carriers won't announce their SARs in 2026. Some will wait until October 1st, the last possible day to notify members. Others may never announce at all, leaving people to open their mailbox and find out when it's already too late. So while the numbers are still rolling in, don't be surprised if we hit well over 2 million people affected in 2026. That's like the entire population of Nebraska being told, sorry, your health plan's gone, good luck. This is what's called a service area reduction, or SAR. Here's how it works. A Medicare Advantage company decides it's no longer profitable to offer coverage in your county or state. They file paperwork. Medicare approves it. And you, the member, get a letter saying your plan is gone. No appeal, no exceptions. You're forced to switch. And this isn't just a prediction. Remember, in 2025, about 1.8 million people went through the same thing. If you were one of them, tell me in the comments, what happened? How did you find out? What was your experience like? Looking at last year's data, at least 6 states were hit hardest, with over 100,000 people affected in 2025. Those states: New York, Georgia, California, Texas, Washington, and Florida. And the percentages were even worse in some of the smaller states. In Vermont, 2/3 of people on Medicare Advantage lost their plan. In New Hampshire, nearly 1/3. And North Dakota, almost a total Medicare Advantage desert. Georgia, in particular, has been hammered by service area reductions year after year, going all the way back to 2020. If you're in Georgia, you know this story all too well. If you live in one of those states, let me know in the comments. And if you went through this last year, share your story. People watching can learn a lot from what you went through. So when will you know? By law, insurance companies have to notify you at least 60 days before coverage ends. For plans ending in December, that means letters will arrive in late September or October. Usually it happens in 2 ways. The first wave, a carrier letter. Your insurance company tells you your plan won't be offered next year. The second way is a Medicare letter, the official non-renewal notice. But here's the catch. Again, some carriers wait until October 1st, the last possible day. Others, well, they don't give anybody an early warning. The only notice you'll get is the Medicare letters. If this happened to you last year, let me know in the comments. When did your letter arrive? Did it feel like enough time, or did it feel like a last-minute scramble? If your plan disappears, here's what happens. You'll get a special enrollment period, and unlike the AEP, it extends past December 7th. The special enrollment period runs from December 8th through the end of February, but here's the catch. If you wait until after January 1st, you'll spend at least part of the new year with only original Medicare Part A and Part B, and no Medicare Advantage or drug coverage, unless you proactively pick a new plan. And remember, original Medicare doesn't cover prescriptions, so unless you pick a Part D plan yourself, you're uncovered. Here's the silver lining. Service area reductions, or SARs, also trigger a Medigap special enrollment period. That means if you've ever wanted a Medicare supplement but couldn't medically qualify, this is your shot. It's one of the rare times you can get in without underwriting. If you're on Medicaid or extra help, Medicare will auto-assign you into a random drug plan. And let's be honest, is that really how you want to get your prescription drug coverage? Auto-assigned by a computer with no idea what meds you take? I didn't think so. That's like musical chairs, except instead of losing a chair, you lose a doctor, your drug coverage, and your entire network, all in one letter. If you don't want to be blindsided by this stuff, make sure you hit subscribe right now and follow me on LinkedIn and Facebook. I'll keep breaking these changes down as they happen. And please, share this video with a friend or a family member. The odds are high that someone you know is going to get one of these letters. Don't let them be caught off guard. So what do you do if this happens to you? Watch your mailbox. The SAR letter might be the only notice you get. Know your rights. If you lose your plan, you may qualify for a one-time Medigap guarantee issue window. That's a rare opportunity to protect yourself long-term. Don't forget Part D. If you fall back to original Medicare, you must add a drug plan unless you want Medicare to pick one for you if you get extra help or you're eligible for Medicaid. And if not, you don't get anything. Act early. Don't wait until December 7th. Once the enrollment window closes, you're locked in until next year unless you have that special enrollment period. If you went through this last year, share in the comments what steps you took. Did you switch to another Medicare Advantage plan? Did you move to a Medigap? Your story might help somebody else. This was part 1 of my 2026 Medicare Crisis Series. I'll be releasing more episodes over the next month, all in the playlist below, so make sure you check them out and subscribe so you don't miss what's coming. If you want straightforward Medicare education, go to prepareformedicare.com. And if you want personalized help sorting through this mess, my wife Nikki and her team of licensed agents at brickhouseagency.com offer free, no-obligation consultations. Remember, there's no obligation to enroll, and they don't represent every plan available in your area. Subscribe, follow, and share this video with a friend or a family member who might get one of those letters. I'm Matt Ferret. Here's to your wealth, wisdom, and wellness. And trust me, this won't be the last Medicare shakeup.